Hello everyone and welcome to the Medical Technology Assessment Program for the first semester in the subject Clinical Parasitology. Mainly in this video, we will be discussing the phylum Apicomplexa. So mainly in this video, we'll be focusing our attention to the blood coccidian under the genus Plasmodium. So, malaria and babesiosis refer to disease processes resulting from infection of parasites belonging to the phylum Apicomplexa. So, their respective genera includes your Plasmodium and Babesia species. So, both genera of parasite belong to the class of parasites that have no obvious structure of motility. So, these are also known as your sporozoans. So here are the general characteristics of your sporozoans. So first, they are obligate intracellular parasite. So that means these are strictly or they require blood cells for their life cycle. Next is that they have no apparent means of locomotion, and in their life cycle, they require two hosts. So the intermediate host is the human, and the definitive host is the mosquito, or specifically the Anopheles mosquito. So remember, for intermediate host, man acquire the asexual stage or reproduction, while for the mosquito, since these are definitive hosts, they acquire the sexual reproduction of the parasite. So we have two types of reproduction. So I believe we have a typo error in our handout. So kindly correct. For sexual, this is what we call the sporogony. So this happens in the mosquito, while the asexual stage or asexual reproduction, this is called the schizogony, where it happens in humans. So let's start first with Plasmodium species. So this is the cause of malaria, mal for bad and aria for air. So this is also known as the bad air. And the infective stage of this parasite to humans is the sporozoite. So clinically significant, sporozoite is the infective stage, while the infective stage for mosquito is what we call gametocytes. So let's talk about the Plasmodium reproduction. So just like we have discussed a while ago, there are two types of reproduction under Plasmodium species. So the first one is schizogony, or the asexual life cycle, and this usually happens in the intermediate host, humans. So the members of the genus Anopheles, specifically the female Anopheles mosquito, are responsible for the transmission of your parasite Plasmodium. So this mosquito harbors the infective stage sporozoites, which are then transferred to human into their bloodstream via the bite of the female mosquito. So upon entering the body of humans, the sporozoites are carried through the peripheral blood or bloodstream to the parenchymal cells of the liver. So these inside the liver cells, this particular sporozoite will develop into cryptozoites, just like here on this bullet. So in this liver cell, cryptozoites will multiply, and this is what we call the erythrocytic cycle. So from the word exo, so that means outside. So this is outside the red blood cell or the blood cell itself. No? So that means in this cycle, it's not the red blood cells that are being attacked, but rather the liver cells. So after a while, the infected liver cells eventually rupture and introduce merozoites into the circulating blood. So these migrating merozoites will target age and size specific red blood cells to invade, and thereby initiating the phase of reproduction involving a red blood cell, or what we call the erythrocytic cycle. So in this cycle, red blood cells are already affected. So the merozoites will attack the red blood cell, and inside the red blood cell, ring tropozoites will be developed. And this ring tropozoite in turn will develop into schizoid inside the RBC. So the schizoid, which contains the merozoite, will be released upon cell rupturing of your red blood cell. So there are multiple ways on what the particular merozoite will do. Okay, so some of these will invade new cells, or some are destroyed by your immune system. So the merozoites will then develop into gametocytes, which are the infective stage for the mosquito. So these are acquired when the mosquito take a blood meal of an infected person. So the transmission of the parasite back into the vector occurs when the mosquito Anopheles ingests the mature gametocytes, specifically your microgametocyte or the male gametocyte, and the macro, which means the female gametocyte. So these in turn initiates the sporogony or the sexual life cycle of Plasmodium species. So the male and female gametocytes or gametes in general will unite into the mosquito's stomach and form a fertilized egg called your zygote. This is also known as the fertilized or motile ookinete. So your motile ookinete or zygote becomes encysted in the gut wall of the Anopheles mosquito. So this in turn develop into your oocyst. So your oocyst on complete maturation will rupture and release numerous sporozoites. So these sporozoites will migrate into the salivary gland of the mosquito and are ready to infect another suspecting humans upon getting bit by the same mosquito. There are several mode of transmission. This is this is not the only one where the mode of transmission is via the bite of an Anopheles mosquito. So we can also acquire sporozoites by transfusion or blood transfusion. So this is called the transfusion malaria. We can also acquire sporozoite via sharing of needles, and although rarely documented, congenital malaria can also happen. So this is the passing of the sporozoites of an infected pregnant woman to their unborn fetus. So let's talk about the first Plasmodium species, and this is your Plasmodium falciparum. So this causes malignant tertian malaria. So when we say malignant, that means this is the most aggressive or most deadly form of malaria. When we say paroxysm, so this is a part, okay, this is an allergic response of our body to the development of the schizoids and also to the circulating parasitic antigens, especially the formation of your merozoites. So if you still remember our sexual life cycle in humans for Plasmodium, or what we call the schizogony, so our cryptozoites, which are the forms of your parasite inside the liver cells, releases merozoites upon the rupture of your liver cells. So these merozoites will now try to kill or to attack your red blood cell in the process. So this causes our body to produce an allergic response to create or to kill this particular parasites. So in this process, chills and fever may be felt by the patient. So this is what we call your paroxysm. So for Plasmodium falciparum, the paroxysm is every 36 hours, or in some textbook, 36 to 48 hours. When we say recrudescence, this is created by our Plasmodium falciparum, Plasmodium malariae, and also Plasmodium knowlesi. So all of these three performs or undergoes the process of recrudescence, where there is a repeated attack of malaria due to the survival of malarial parasites. This is more common on people with low immune system. So the process is still ongoing as long as that there are red blood cells, or as long as the patient is not being treated, or what we call the recrudescence. This is very different from your true relapse in a way that this occurs when patients become reinfected with rupturing hypnozoites. So, sir, what are hypnozoites? So, hypnozoites are a form of the Plasmodium species that are inside the liver cells, which are dormant. No, sometimes there are textbook that says that your hypnozoite may be dormant in the liver cells for more than 10 years. So imagine that particular type of process where you think that you are already treated, but in truth, these hypnozoites are only dormant in your liver cells. So anytime they can attack and rupture and attack your red blood cells in the process. So for true relapse, we only have two Plasmodium species that undergoes this process, and that is your ovale and vivax or OV. So in pathology for Plasmodium falciparum, this is what we call the cerebral malaria and black water fever. And this is the most common Plasmodium species in the Philippines. So for the pathology, we'll discuss this later on. So for Plasmodium falciparum, the infected RBCs are normal in size, but remember this parasite invades all stages of red blood cells. That's why this is so called the malignant malaria, because it can attack different stages of red blood cells, including your immature or your reticulocyte and also your mature RBC. In terms of the presence of pigment or granules, this is called your Maurer's dots, but in some textbook, this is also called your basophilic stipplings. For diagnostic purposes, peripheral blood smear is used, so ring forms and gametocytes are the diagnostic stages of this parasite. So for ring forms, these are smaller in size or what we call applique, and for gametes or the mature female and male gametocytes, these are crescent or sausage shape. For tropozoite and schizoid, these are not preferred since these are seldomly seen in the blood smear. So here is a picture of your rings or ring form of Plasmodium falciparum in a thin blood smear. While for the gametocytes, the characteristics of a crescent shape or sausage shape appearance is diagnostic for Plasmodium falciparum. Here is a tropozoite of your Plasmodium falciparum. So this consists of 1 or 2 rings that possess each a heavy cytoplasmic ring. While for schizoid, so as you can see, there is the presence of multiple chromatin bodies surrounded by a cytoplasm and visible in severe infections only. So here is a side-by-side comparison of the gametocytes for Plasmodium falciparum and the other Plasmodium species. So as you can see, the only different is your Plasmodium falciparum in terms of the differentiation under gametocytes. So this is the only crescent shape gametocytes for Plasmodium species. So again, the pathology behind Plasmodium falciparum is malignant tertian malaria. So this happens after 7 to 10 days of incubation. So upon getting bit by the infected Anopheles mosquito, around 7 to 10 days, the patient will manifest the signs and symptoms already. So this is a daily episode of chills and fever due to the presence of your merozoites in the blood, severe diarrhea, nausea, and vomiting. So in chronic stages, the brain, kidney, and liver may be affected. So let's talk about the involvement of your Plasmodium falciparum in chronic stage. So just like what we have discussed a while ago, your Plasmodium falciparum causes the deadliest form of malaria, especially in untreated patients. So remember, Plasmodium falciparum attacks or invades all stages of red blood cells. So imagine these blood cells simultaneously rupturing within our body. So this releases large amount of toxic cellular debris and also malarial pigments. So these debris and malarial pigments may block the different vessels that connects our organs. So for the brain, this is what we call the cerebral malaria. So your Maurer's dots, which is your malarial pigment, together with the different cellular debris caused by the rupturing of your RBC, may block the brain vessels, causing tissue hypoxia. So the oxygen, is not delivered in the brain, causing coma and eventually death. This is also similar to black water fever, but the organ involved with this particular pathology is the kidney. So usually, in sudden massive intravascular hemolysis, which also happens in malaria, so this is the simultaneous rupturing of your RBC, hemoglobin is released on that particular process. So our body cannot take up the increased hemoglobin in our blood. That's why some of these particular pigment, your hemoglobin, is released in our urine. So this is so-called black water because the urine of the patient is colored black due to the presence of blood. Next one is Plasmodium vivax. So this is called the benign tertian malaria, and the paroxysm or the fever and chills is felt by the patient every 48 hours. So this is also produces true relapse where it has the capability to be dormant as hypnozoites in your liver cells. So this is also the most widely disseminated and most prevalent Plasmodium species. In terms of the morphology for Plasmodium vivax, this infects RBC, which becomes enlarged in size, and only the young RBC, or what we call the reticulocytes, are infected with this particular parasite. In terms of the pigment or granules created, this is what we call the Schaffner's dots or eosinophilic stipplings. For the stages, all stages are seen in the peripheral blood smear. So let's talk about each one of them. So for the ring forms, these are single large ring succeeded by amoeboid form in the pale large red cell. So from the word large, since the infected RBC for vivax are enlarged, no? So we look for the large red cells with a single large ring. That would be your ring forms already. So later on, we'll show you the different pictures of this particular stage. Trophozoite is associated or described as a large amoeboid cytoplasm plus the presence of the Schaffner's dots or the pigment inside this type of cytoplasm. So next one, for the schizont, the presence of multiple chromatin bodies is the diagnostic part or stage for our Plasmodium vivax. So this emerged from the due to the progressive chromatin divisions happening inside the RBC. For the gamedocytes or the mature gametes, these are large pink to purple chromatin mass with a colorless to pale halo under the GEMSA stain. So let's look at the pictures. So for the first picture, this is what we call the ring forms for Plasmodium vivax. So take note of a single large ring just like here on this picture, succeeded by an amoeboid form in the pale large red cell. While in this picture, this is what we call the trophozoite form. So as you can see, the large amoeboid cytoplasm. So the shape of the RBC is already disintegrated, or this is already the deformed form of our RBC. So it become an amoeboid-like. Okay? So the presence also of the Schaffner's dots, which is represented by the small dots all over the cytoplasm. Next one is the schizoid. So as you can see, the dark staining characteristics is due to the presence of multiple chromatin bodies inside the cytoplasm. Next one is the gametocytes. So take note of the large to pink purple chromatin surrounded by a colorless to pale halo. Also take note of the size. So on this RBC, this is the uninfected RBC, while this one is the infected RBC with Plasmodium vivax. So as you can see the difference in size. So this infected one is bigger than the normal uninfected. So for the pathology for Plasmodium vivax, this is similar to falciparum but is less deadly, or what we call benign. So it has also a longer incubation period at around 10 to 17 days. For the signs and symptoms, very similar to Plasmodium falciparum. This includes your flu, nausea, vomiting, headache, muscle pains, and photophobia. For the chronic stages, this is also similar to Plasmodium falciparum, where pigments and malarial pigments and debris, may block the vessels surrounding the different organs. So this can cause tissue hypoxia depending on the infected blood vessels in the brain, liver, and kidney. So the difference in terms of pathology for Plasmodium falciparum, for vivax, it can cause true relapse, where dormant hypnozoites may cause relapses months to years following the initial infection. So they become dormant in the liver cells and may attack anytime for after a month or years. So the next one is Plasmodium malariae. So this causes Quartian malaria or malarial malaria. So this is so-called Quartian because the flu-like symptoms or paroxysms happen every 72 hours. So upon getting exposed with the parasite, the incubation period is around 18 to 40 days, which is quite longer than the first two Plasmodium species. For the repeated attacks, this causes recrudescence as well, just like your Plasmodium falciparum. So in terms of Plasmodium malariae, the infected RBC are normal in size. So this is similar to Plasmodium falciparum. But remember, the difference is for malariae, it invades only the mature or old RBC, while for falciparum, it invades all stages of the red blood cells. In terms of the pigments, this causes Zeimann's pigments. For the stages seen in peripheral blood smear, few ring forms may be seen, as well as mature tropozoites and schizonts. So let's talk about the different descriptions for these stages. For the ring forms, the presence of a single large compact ring, which are usually band forms, no? Anong itsura ng band forms? Usually pa-sausage sila, no? Surrounding the RBC. So your band forms is usually unique to Plasmodium malariae. So kapag nakita niyo sa question, may presence ng band form inside the compact ring or in the RBC, usually Plasmodium malariae. Also, for their tropozoite, as you can see, occasional band forms with Zeimann stipplings are more common. For their schizoids, these appear as rosette or daisy head or fruit pie in terms of the merozoites. So yung ano nila, their merozoites are arranged in a rosette form. For the gametocytes, these are not diagnostic since the shape is only visible. So here is a sample picture of the ring forms for Plasmodium malariae. So this is smaller than Plasmodium falciparum and connected by a heavy ring or a heavy chromatin dot. While for the tropozoite, take note of the presence of a band or bar shape, no? So this is a band form of your tropozoite for Plasmodium malariae. Next is the mature schizoid. So as you can see, the presence of 6 to 12 merozoites inside the RBC that are usually arranged in rosettes or in a daisy head or in a fruit pie is characteristic of this stage. And lastly, for the gametocytes, these appear darker in terms of the pigment compared to your P. vivax. So the next Plasmodium species is Plasmodium ovale. So this also causes benign tertian malaria just like your Plasmodium vivax. Or sometimes this malaria is called ovale malaria as well. So the flu symptoms or the paroxysms happen every 48 hours. So the incubation period is similar to P. vivax at around 10 to 17 days. For the relapse, this undergoes through relapse as well, just like your P. vivax. So they can produce dormancy within the liver cells and may attack several months or years after the initial infection. So remember, for Plasmodium ovale, the infection may last approximately 1 year, while for P. vivax, the infections may last several years after the infection. So for Plasmodium ovale, the infected RBC are slightly enlarged and sometimes may be oval in shape or fimbriated. When you say fimbriated, so that means for the RBC, sometimes hair-like extensions may be seen surrounding the cell. So in terms of the infected RBC, only reticulocyte or young RBCs are more infected with this particular parasite. So for the pigment or granules, the presence of James and Schaffner's dots may be seen within this parasite. For the stages seen in peripheral blood smear, all stages are seen in this parasite as well. So let's talk about the different forms or stages for Plasmodium ovale. So for the ring forms, it has a single compact ring. For the tropozoite, take note of the presence of a round to oval that is fimbriated tropozoite, no? So ang keyword natin for Plasmodium ovale in terms of their morphology is the presence of fimbriations. Next, for the schizont, this may resemble also your Malariae, where rosette or irregular clusters of merozoite are present. For the gametocytes, as you can see, round to oval that are or that may be fimbriated. So here is a sample picture of the ring form for Plasmodium ovale. So this is similar to Plasmodium vivax, but the presence of fimbriations is clear on this stage. Also for your tropozoite, fimbriations, although hindi masyadong kita dito, it also has a round to oval shape which is slightly enlarged, so compared to a normal RBC. Next one is the schizoid. So as you can see, the presence of fimbriation is still evident on this particular stage. So these also has a rosette or irregular cluster just like your Plasmodium malariae. And lastly, for gametocytes, this is similar to P. vivax but smaller in size. And the last Plasmodium species that we'll be discussing is Plasmodium knowlesi. So this causes quotidian malaria and a former parasite of Old World monkeys or monkeys in Europe, Asia, and Africa. So tinawag siyang quotidian because the paroxysm happens every day. No? So the patient experiences chills and fevers every 24 hours. So the severe case usually includes your respiratory distress, acute renal or multi-organ failure, and even shock. So it's quite similar to other Plasmodium species as well. So this also undergoes recrudescence. So in terms of the infected RBC for Plasmodium knowlesi, there are no specific references that details the change of size for the infected red blood cells. But remember, for knowlesi, this also infects all stages of RBC. So this is similar to Plasmodium falciparum. For the pigment created or granules, this is what we call the stinton or mulligans. For the stages seen in peripheral blood smear, ring forms and mature schizoids are more common. For the ring forms, this resembles your falciparum, so they have small applique. While for the tropozoite, these are band-shaped. For the schizoids, this fills the RBC and the pigments collect into one or few masses. While for the gametocytes, these are rounded to oval with homogeneous cytoplasm. So here are the sample pictures for the stages of your Plasmodium knowlesi. So here is the ring forms, so very similar to Plasmodium falciparum. While for the band-shaped tropozoite, this is similar to your Plasmodium malariae. Next, for the schizoid of Plasmodium knowlesi, the presence of the pigment being concentrated in the middle is characteristic of this stage. While for the gametocytes, this is rounded to oval with homogeneous cytoplasm. So now let's discuss the diagnosis for malaria or Plasmodium species. So the thick and thin blood smear is the gold standard for diagnosing these types of parasite, and this uses Gemsta stain or Wright stain for their identification. So this is a blood smear that uses capillary blood. Okay, preferable ang capillary blood, but venous blood may also be used. So this is collected every 6 to 12 hours, but in other sources, before the fever strikes. So now let's differentiate the thick and thin blood smear in terms of their procedure. So normally, we collect 2 smears per patient. For the thick smear, we drop dehemoglobinized blood on the center of the glass slide. So we concentrate the blood at the middle and let it air dry and examine 100 oil immersion fields. So remember, for the thick smear for malaria, this is only for the rapid identification. So the question here is there a presence of Plasmodium or not? While for the thin smear, 1 drop of blood, so we create a feathered edge appearance, just like a normal feathered edge blood smear in your hematology. So we let it air dry and fix the slide with absolute methanol. So compared to your thick smear, your thin smear, we have to examine more oil immersion fields at around 200 to 300. For the thin smear, this is for the species identification. So what specific Plasmodium species is present on the blood? So now let's enumerate the different antigens created by your Plasmodium species. So the first one is the HRP2 or the histidine-rich protein. So this is uniquely created by Plasmodium falciparum. While for PLDH and Plasmodium aldolase, all of our Plasmodium species may produce these types of antigens. So here are the different tests for the detection of malarial antigen. So the first one is the parasite F. So this detects the HRP2 which is created by Plasmodium falciparum. So the test strip was placed in the lice blood sample and antigen in the sample binds to the immobilized antibody as it soaks up the test strip. So a drop of liposome detector particles containing a red dye and coated with rapid antibodies which were also raised against the peptide sequence was added next. So these particles were bound to the captured antigen as they swept past the strip, resulting in a distinct solid pink line in the case of a positive reaction, just like here on this picture. So the next one is the optimal test. So this is similar in principle for your parasite F, but this detects both the HRP2 and the parasite lactate dehydrogenase. So this is a rapid detection test using a dipstick coated with monoclonal antibodies against the metabolic enzyme of your PLDH and HRP2. So in cases of presence of Plasmodium in the blood sample, the PLDH captured by the conjugate reacts with the specific antibodies against the Plasmodium falciparum or Plasmodium species. So the reactions are demonstrated by the presence of a dark purple lines in this video or in this slide, 2 lines for P. vivax and 3 lines for P. falciparum. So the band of the procedure control must always be present to validate a result. Normally, in cases of absence of the control band, the test is not valid. So lastly, we have ICT malaria, PF and PV. So it stands for Plasmodium falciparum and Plasmodium vivax. So this uses the principles of immunochromatography and detects the HRP2 plus the Plasmodium aldolase. So ito naman mas unique siya kay aldolase and the presence of 2 lines connotes for P. vivax and 3 lines for P. falciparum. So this is just a nice to know, but people with Duffy negative blood usually are resistant to P. vivax infection, while people with sickle cell trait, sickle cell anemia, and G6PD are resistant to Plasmodium falciparum infections. So that ends our discussion for Plasmodium species. Thank you and good day.